I've had great care, and my doctor genuinely cares. But he's burned out.
They're overworked, they're overwhelmed, they're ready to take what they believe is taking care of the patient and send them home.
And that's probably due to the fact that they don't have enough doctors to deal with the number of veterans that they're seeing.
It has in the past been where it's just easier to write a script and move on. It turns into a numbers game. How many patients are they to see a day or expected to see a day?
We need to make sure that we have enough providers, qualified providers.
One of the problems that I don't feel like it was really successful as far as the therapy part was there wasn't even a prescriber there for the Suboxone. There wasn't licensed, clinical social workers or therapists to run groups. I don't feel like they were intentional by being neglectful. They just didn't have the resources.
They just have, 40 patients they have to see that day, and they have to get through them all. I think that cuts each sliver of how much care they can give each patient, it cuts it down.
The thing that I see a lot with our providers at the VA, either you're assigned to them for the whole time you're there, or you have a resident. You can't build a good rapport with a resident that you may only see them once, and then the next time you come for your checkup, you have another doctor, and you have to go through the whole spiel again.
And the guys are saying they're disrespected. I don't understand that unless they're still in pain, but they've screwed up so much that they can't be trusted, and they get mad at that.
I know it's common practice to blame the doctors and blame the VA and blame.
None of us want to go into the ER and say, look, I'm a recovering addict, but they might not give me the pain med I need. That's always the first thing. But then you slide it, or they're not respecting me or believing me, and I don't trust it.
I think what has happened is that the system is not looking at the true cause of the opioid addiction. Everybody that's addicted, for the most part, is saying that it's because of pain. I'm not gonna buy that anymore.
Okay, your leg's been broken. You should have healed in 3 months. It's 9 months. You're still asking for more pills. I'm not gonna give them to you. Then you'll hear, you don't respect me. That's the addict protecting his shield.
They may need it now because they're addicted to it.
He can't help himself.
A lot of the times you have addicts who want to get better, but they can't afford the treatment, or they don't have the insurance to help with the treatment. I think that's a big barrier, the funding in itself.
Addiction as a whole, it's not a battle that you're going to win by having facilities closed off, and this facility and then this facility. It has to be a network. It has to be.
The various VAs across the country, somehow or another, need to find a way to share the information of the various programs that they have in their hospitals and clinics that's really working.
If we can't help people in-house, we need to be more willing to find doctors outside that will.
You hear the saying that it takes a village to raise a child. Well, in order to help the individual to get rid of the stigma of being addicted, it takes a community of people within the VA system. It takes a community of people outside of the VA system, people who were in the military, people who may have been addicted to certain types of opioids, to share with these individuals the fact that they are worthwhile, they are of value.